Good afternoon, everyone, and thank you for joining us today at our special media briefing, largely focused on the upcoming vaccination rollout. I want to welcome Paul Johnson, our Director of Emergency Operations, and Michelle Baird, the lead in our vaccination task force effort going forward. They'll be sharing some information a little later on about all of that. Coming up on Monday, March the 15th, as you may know, is the provincial COVID-19 provincial portal that will open. Paul and Michelle will be providing some additional information on how you can get help and assistance and in terms of getting bookings on that particular system. I do want our community to know that we are ready to administer as many vaccines as possible, depending on supply. So as supply comes in, we are ready and able to get them into the arms of individuals with all of the necessary clinics set up to be able to do that as quickly as humanly possible. And unfortunately, this vaccine rollout is going to continue to take some time, and we certainly continue to ask you for your patience. There are a number of priority areas that have been done and many more to do. And then certainly the mass vaccination of the populace at large will be up and coming as soon as that mass amount of vaccine is available. One thing I can say with certainty is that everyone that is eligible and wants a vaccine will get one. Full stop. Everyone's going to get one. It's not going to be you're going to be left behind or forgotten about or not thought about. All the folks that are in the priority category are getting vaccinated or have been vaccinated, and hopefully soon this is the high risk folks and long-term care folks, residents and employees. More of our essential workers have been vaccinated. And that'll keep going until the first priority category is done, which we hope will be soon. But all of this will be dictated by the supply coming from the federal government to the province and province to municipalities. And we will continue to follow the prioritization schedule as set by the province of Ontario. So all of that is ongoing, and that hopefully will find a way of accelerating itself with hopefully a smooth launch of the provincial system that we've been long waiting for, and hopefully will help ease some of the challenges that we've been facing in terms of getting people dialed in. So on that note, I'm going to turn it over to Paul Johnson to continue to share some additional information on the localized version of what you can expect, and then over to Michelle to give us even more detail. So Paul.
Thanks very much, Mr. Mayor, and it's great to be here with Michelle. As you know, our medical officer of health, or as you can see, is not with us live, although in just a couple of minutes you're going to hear from her via video. But Dr. Richardson is going to share a little bit of information by video with us today. But it is great to have Michelle here. She is the Director of Operations in Hamilton Public Health Services through this pandemic. She plays a different role once this pandemic is finally over. She'll shift back to that, I'm sure, with some joy because she has been working incredibly hard to not only take us through the early parts of what we've been dealing with in this pandemic, but now squarely focused as well on making sure that we're ready for the rollout of vaccine over the coming months. So she is overseeing all the local aspects of our vaccine programs in Hamilton, and you'll hear from her in just a couple of minutes. From my chair, in terms of looking at it as the Director of the Emergency Operations Center, I'm really pleased to be able to say with confidence that we are ready to take the next steps in vaccinating our community. As the mayor stated, that doesn't mean we're going to be able to deliver on that in the next 2 days or the next 2 weeks, but we are ready as these next weeks and months unfold for us to ensure that we meet what the mayor said, which is that everyone who is eligible and wants to have the vaccine will eventually get that. We are asking people to be patient. Be patient with the systems that are in place to help you book. Be patient with the people who are trying to assist you to get those bookings, and be patient overall in terms of when you will actually be able to book an appointment. We would love to say that we have all the vaccine we need to tackle the priority populations that we're working with now, but the answer is on a week-by-week basis, we don't. And so we will continue to await for those supplies to increase and the number of vaccines that we have available to increase, and we will book people in as fast as possible once that occurs. but there will be increased opportunities for people to access the vaccine. And we're really pleased that on Monday, those who are over 80 or over, born in 1941 or earlier, can use the provincial online booking tool. And I know that those are words that ring nicely in people's ears, because the last 2 weeks, as we have helped thousands of older adults access vaccine, it has been a less than smooth and efficient process. And the reality was that was because we did not have an online booking system to utilize. So that changes on Monday. We've redeployed hundreds of individuals at the city to help with vaccine rollout and hired others to assist us as well. And they'll be helping you in all aspects of this vaccine delivery, including having people available to answer some calls when our public health hotline restarts on Monday. And I want to talk about the hotline for just a minute, because it's very important that we realize on Monday, the way we book vaccines changes. For those who are eligible, going through the online booking process is the way that you can book an appointment for vaccine. It is the fastest way, it is the most efficient way, and it is the way that we are encouraging you to access it. However, we realize that some may run into difficulties and not be able to complete their booking or even do their booking online. And so for those small number of people who may need some further assistance, we will have staff available to answer phone calls 7 days a week. The hours during the weekdays will be 8 a.m. till 8:30 p.m. and then on the weekends from 8:30 to 4:30 p.m. And you will be able to access that beginning on Monday. Again, if we have several hundred people call all at once, our system cannot handle that. There isn't really a system that any municipality has that can do that. But we do have more operators and more call center staff that will be able to answer your questions. And we do have a larger queuing system that will allow people to wait on hold while the next person comes along to answer your questions. But I want to reiterate, this is not an alternative system for you to book your appointments. If you are able and can book through the online booking tool, that is the way that you need to do it. And in fact, most likely you will be asked by our call center staff if you have attempted to do that before they assist you with your questions. And that way we can make sure that the call center is there for those who have difficulties doing it. And we can ensure that that they do not have to wait or get a busy signal, but they can get through. And for those who have the ability to book online, just use that. And the instructions that you're going to hear in just a second are very straightforward, and they'll be well documented on our web. They're available in various languages, and we will do everything possible to make sure that people can use that online booking tool. Just a reminder for those who are 85 years and older or their families, that as of Sunday, the callbacks from the hospitals will cease. So if you have not received a callback by the end of the day, end of business day on Sunday, then on Monday, please use the online booking tool to book an appointment. But we have done great work in terms of helping and assisting the hospitals to make those callbacks here at the City of Hamilton, and hundreds more people have been booked in for appointments in the last 2 days alone. So as we prepare for Monday and a new way to book for an expanded group of people who are eligible for vaccine, I'm now going to turn things over via video to our medical officer of health, Dr. Elizabeth Richardson, who's going to talk a little bit about the steps that it takes, very simple and straightforward steps that it takes in order to book online, so that people over the weekend can be prepared if you are eligible for that booking come Monday. So over to the video and over to Elizabeth.
As many of you know, on Monday, March 15th, the provincial government will be launching an online tool to book appointments for COVID-19 vaccine as people become eligible. I'm going to go through a simple step-by-step instruction on how to book an appointment once you're eligible. Step 1, have your green Ontario Health Card on hand. You're going to need this. Step 2, on your computer, open any web browser and enter www.hamilton.ca/vaccine booking. Step 3, make sure that you're eligible for the vaccine at this time. The province decides who is eligible, and the list of who's eligible is on our vaccine booking website. Step 4, if you're eligible, go on to click the booking link that's on the page. It will take you directly to the provincial portal. Step 5, fill out the personal information that you see there. Choose the clinic location you would like to go to from the list of options, as well as the date and time for your vaccine appointment. Now make sure to keep a record of the clinic and the vaccine appointment date and time. And that's it. You're all set. Now, if you do not have access to the internet or to a computer, or you don't have a health card or have problems with your health card, you can call the Public Health Services COVID-19 hotline at 905-974-9848, option 7. Please make sure you register yourself online if you're at all able to do so, or ask a family member to help you. It's the quickest way to get an appointment. The hotline is going to be there to help those without health cards and those without computer access. As the province launches the portal, please do have patience with any potential bumps along the road. We know everyone is anxious to get their vaccine, and we are anxious to get it to you as the supply becomes available. Everyone is doing their best, and we'll get through this together, Hamilton.
So as you can hear from Dr. Richardson, reiterating the point that online booking is the way to go. Those steps are very simple and straightforward. And again, that will allow the hotline and resources to be available for those who have difficulty, who find out that they can't do that through the online system. So that repeated message to the public, and our hope is that our media partners can continue to push that online booking piece is the place for people to go. So as you may know from the media, Toronto today did allow access, or had access allowed by the province to this booking tool, and they are starting to book people via this site. So that is for Toronto only. This will become available for us in Hamilton when everything goes live for those who are using the provincial tool on Monday the 15th. And with that, for some more detail in terms of all of this work that we're doing to prepare for the expansion of vaccine rollout, I'll turn things over to Michelle.
Thank you, Mr. Mayor and Paul, for those updates. It's great to join you here this afternoon. I want to take a few minutes to discuss our vaccine plan in Hamilton. Earlier this week, we passed an exciting milestone in the number of vaccination doses administered in our community. We've now administered over 50,000 doses of COVID-19 vaccine locally, and the number of Hamiltonians who have received their second dose is now just over 16,000. All good reasons to celebrate. None of this work would have been possible without the incredible work of our team at Hamilton Public Health, who I'm incredibly proud, and our partners at St. Joseph's Healthcare Hamilton, Hamilton Health Sciences, our primary care physicians and nurses, and Hamilton Paramedic Services. We have continued to do this work with a very limited vaccine supply to date. We are seeing some increases in our supply as of March 22nd, however. And to ensure that we're ready to administer this vaccine, March 22nd is when we will be launching the first Ontario Centre as a large-scale COVID-19 vaccination clinic in Hamilton. Though this clinic is anticipated to start administering vaccines slowly on March 22nd, it actually has a full capacity of 3,000 vaccines per day, and that will be realized as we move forward. This large-scale clinic is in addition to the Hamilton Health Sciences Clinic that's operating and continues to vaccinate healthcare workers, community healthcare workers, and our essential caregivers, and the St. Joe's Healthcare Hamilton West Campus large-scale vaccine clinic, which is currently vaccinating community members 85 years of age and older, Indigenous adults 55 years of age and older, and our adult recipients of chronic home care. The Rosedale Arena will be the site of another large-scale clinic, as Dr. Richardson mentioned earlier this week. Further details with respect to the Rosedale Arena site will be coming down the road. Over the coming weeks, we will be prepared to be able to provide 10,000 doses of vaccine each day. We are eagerly anticipating seeing our vaccine supply increase in order to allow us to reach this capacity. As we open for appointments for booking online, you will see fewer appointments available than this. We will open appointments in alignment with the supply of vaccine that's available. The last thing we want to do is offer appointments and not have the supply to match. We don't want to be in a place to cancel appointments. With these large-scale clinics launching and soon to be coming online, our mobile clinic continues to make its way to the various corners of our city. We've already seen our mobile clinic vaccinate some of our most vulnerable populations, including community members residing in long-term care and retirement homes, and our shelter population. All retirement homes, high risk and others were all visited by the mobile clinic for first doses in residence, with second dose scheduled for those low risk retirement homes starting on March 14th. Pop-up vaccination clinics will continue to serve different neighborhoods and populations in our community. As it says right in the name, these clinics pop up. We've had them popping up in Stony Creek, Glanbrook, Ancaster, Dundas, and Waterdown to vaccinate community members 85 years of age and older. I've had the good fortune of being able to be on site at our pop-up clinics, and the joy and excitement among our seniors receiving vaccine is palpable. It provides such positive reinforcement to our whole team. 2 mobile pop-up clinics discontinued administering vaccines as of end of day, March 9th, and those include the clinic at Harry Howell Arena and the clinic in Glanbrook. The other pop-up clinics will follow suit on March 13th. Pop-up clinics will continue to be set up by Hamilton Public Health Services and will move through our community according to vaccine supply and the needs of specific neighborhoods. We really want to be sure that those who are unable to come to a large clinic and those in our most vulnerable neighborhoods have access to vaccine, and our pop-up clinics are continuing to provide this opportunity. Earlier this week, we were very pleased that the Ontario government tapped a number of Hamilton's primary care providers to administer the AstraZeneca vaccine to community members 60 to 64 as part of a pilot program. As mentioned earlier this week, these primary care settings have been chosen to participate in this pilot program by our Hamilton Family Medicine partners in areas throughout the city where residents have been identified as being disproportionately impacted by COVID-19. Vaccinations as part of this pilot program will begin as early as tomorrow. Eligible residents will be contacted directly by their primary care physician's office to book appointments if they are part of the pilot program. Unfortunately, at this time, there's no other booking options for this pilot program. Residents are asked to please not contact their doctor's office for an appointment, but rather wait until they reach out to you. This is consistent with all of the vaccinations happening in our community. They are by appointment only. Walk-ins are not accepted at this time. To remain flexible and adaptable to the vaccine supply and prescribed timelines by the Ontario government, our plan continues to be in an evergreen state, and we're updating it as we move along. Partners from across Hamilton's health sector continue to work together to ensure that COVID-19 vaccines are distributed effectively and equitably once they arrive locally. We are focusing on implementing the provincial framework to ensure prioritization of key populations in our communities is met, and the logistics around local storage and distribution of vaccine supply are ready to be launched. As Elizabeth noticed, information regarding registration, booking, and sequencing will continue to be available on the COVID-19 vaccine site at www.hamilton.ca/COVID vaccines. Thank you so much for this opportunity to share some details of our plans for the weeks to come. I'll pass this back to you now, Mr. Mayor.
Thank you very much, Michelle, and thank you for your ongoing work. It's been an enormous challenge for you and your team to be ready at this point, and obviously we all share the frustration of varying supplies of vaccine, and we all share the desire to get it into the arms of individuals as quickly as we can. So thank you for that great work and for sharing this information. And I'll reiterate the notion that on Monday, it is for 80 plus only to go online, or anyone that has not yet been reached by a callback through the 85 plus category. So please don't anyone else go and try and book an appointment, because that is not for you. There will be another time for you down the road. Right now it's 80 plus, and those that we haven't yet reached by 85. If you booked into the healthcare portal, you do not need to book here. You will be called separately through that process. And so don't tie up these lines, because we don't want to have this system crash with people that are trying to book on here that aren't yet eligible for the vaccine. So please be mindful of that. And at the same time, be mindful of the public health measures that we still very much need to adhere to. So the vaccine is still very much out, or sorry, the virus is still very much out there. The variants are of concern, and they certainly remain something that is a risk that our public health is looking at very carefully. And it may or may not cause us to go to a further lockdown, but it's certainly something that we need to continue to protect against. And so all the masking and the physical distancing and staying at home as much as possible is still very much the order of the day. I'm sure that that's not a message you want to hear, not one that I want to deliver, but it's the reality of where we are. And it is something that we should not let go of now, given that we are getting closer and closer to vaccinations for everyone. So please continue to follow the public health advice on the rigorous hand washing, masking, and physical distancing, and staying home as much as you can. When the vaccine is available to you, whether it's Pfizer, Moderna, or AstraZeneca, or down the road, Johnson & Johnson, please get the vaccine. It is the best path for us to get to a more normal existence in our community. If we can get a 75% vaccination rate, then we do have an opportunity to relax many of the regulations that we're currently having to adhere to protect ourselves. So please ensure you get it. The testing on the vaccine has been rigorous. Hundreds of thousands of people have been tested. And I think all of our public health officials certainly advise that it is safe and that it's highly recommended that you get it. And for all of them, it will prevent hospitalization or illness. And obviously for some that have the second dose requirement down the road, that will help boost that vaccination and immunization going forward. So please continue to listen to our public health officials, and when that vaccine is available to you, when you get called and when that booking is lined up, please take the vaccine. On that note, Jasmine, I know you have the media here, so let's turn it over to you for some media questions.
Great. Thank you very much, Mr. Mayor. We have 4 media on the line today. So just a reminder to everybody, today we are focused on vaccine program related questions only. So we'll start with 1 question and 1 follow-up from everybody. First question can be to Kelly Botello from CHCH. Kelly, you can go ahead.
Hello, everyone. I spoke with the Hamilton Family Health team today, who say that they decided which clinics were going to be administering the AstraZeneca vaccine. In terms of the high-risk areas, I guess, are those? Can you explain how, those clinics will be administering the vaccine in terms of how they were decided on?
Thanks, Kelly. I can answer that question for you. So as noted, there are a number of primary care practices within the city that are providing AstraZeneca vaccine to the 60 to 64-year-olds. They were decided on based on a couple of things, looking at the city and the areas where most vulnerable populations live. So really looking at those socio-determinants of health factors, as well as areas of the city that have been hardest hit by COVID so far this year. And then the primary care practices within those geographic areas are the ones offering vaccine.
Thank you, that's all.
Okay, great. Next we'll go to Lisa Pileski from CHML. Lisa, you can go ahead.
Hi, I hope you can hear me okay. Thanks very much for taking my questions. First question, I guess, would be for Michelle Baird. Was inquiring earlier this week about public health and the efforts to vaccinate Hamilton's Indigenous adults living in the community. Just wondering if you have an update on that, and as well as possible strategies that the city is engaging in to overcome vaccine hesitancy.
Thanks, Lisa. Happy to answer that question. So with respect to our Indigenous population in Hamilton, we have a couple of strategies underway. Our urban and Indigenous population right now are eligible to receive vaccine from the St. Joe's large-scale clinic. That clinic right now is accepting urban Indigenous adults over the age of 55, but we're opening that to the full Indigenous population as of next week. So those appointments are available. In addition to that, Hamilton Public Health has a mobile pop-up clinic planned for the week of March 22nd at Des Droits de Desnay. So it'll be an on-site clinic, much in the same way we did in those geographic clinics or in long-term care. So people will just be able to come on site and receive vaccine there as well. We do have quite a robust system in place in the city where we're working with our partners through a vaccine readiness network to try to address some of the concerns around vaccine hesitancy. We've been working directly with the leaders within the Indigenous population and really trying to understand what the barriers are to vaccine and how to really promote vaccine competence within that and confidence in the vaccine within our population. So we have a couple of strategies underway with respect to availability of vaccine, and then of course working with the leaders in the population to try to understand best ways to reach that population.
Okay, thanks. So I guess my next question would be in terms of, when the kind of rollout to the 80 plus it begins next week, just wondering about the how many appointments you kind of expect to see per day and the booking, basically how that's going to look going, to start as I know you plan to ramp up and roll out to as many people as possible, but to start, like, what's the capacity at this point?
So Lisa, over the coming week, as I said, that we aren't yet at full capacity with respect to vaccine, but we do have appointments available at St. Joe's Hospital for the 80 plus. It will be as of Monday, and those appointments will continue. I think we're in a very good place in that right at this point in time, 55% of our over 85 population has received their first dose of vaccine. So we're well into that population already, which is great news for us. And we do anticipate over the next couple of weeks that we'll have enough appointments to accommodate all of the 80 plus in the city.
Great, thanks, Michelle. Next question will be to Christine Rankin from CBC Hamilton. Christine, you can go ahead.
Hi, folks. So I just wanted to clarify something about the health card usage. So people will need to have it for the provincial online system. But I think the city said earlier this week that it's not needed if doctors are calling and contacting for an appointment. Why is this?
Thanks, Christine. So in order to book online, you do need to have a health card. It's one of the fields that are mandatory within the provincial tool. However, if you call us on the phone, we do have the ability to book into COVAX On and get you booked into the system without a health card. There is a process we can use to do that. The same process, of course, through other call centers as well. So absolutely not having a health card is not a barrier to receiving vaccine. It's simply that you're not able to use the online booking system.
Okay, great. Thank you so much. And my next question is that I believe that residents, are seeing different health units move to this 4-month time frame for getting a second dose. What would you say to people at home who might be worried about this?
So there's lots of evidence, Christine, to suggest that the pushing out the second dose to 16 weeks, which is 4 months, which is what has happened across the province, there's still great efficacy with the vaccine. And in fact, at a population level, it allows us to reach a greater number of people quicker, which gets us to a better place where we all want to be, where we really reduce the burden with respect to COVID. So having that second dose at 16 weeks provides individual coverage that's effective for the individual as well as for our population.
Great, thank you, Michelle. Next question will be to Katrina Clark from the Hamilton Spectator. Katrina, you can go ahead.
Thanks so much. We're hearing that public health is struggling to call back people on the 85 plus who've left their contact information at that 85 plus line, and that as a result, some clinics are having to scale back hours because they just don't have enough people coming to the appointments, even though more people are still, waiting to get called and to get their appointments. Is that correct?
Hi, Katrina. So we did register a number of people, as you know, through the phone system. In addition to that, we had a population that we already knew of who were patients at both St. Joe's or Hamilton Health Sciences. Many of the folks that we registered by phone, of course, were overlapping with that population. Over the past just over a week now, we have been, trying to make phone calls to get back to these clients and really have been able to book hundreds of clients a day. However, St. Joe's Hospital did scale back appointments as a result of trying to fill appointments without an effective tool to do so. We are highly reliant at this point on the provincial tool, allowing us to overcome that barrier so we can open up appointments quickly and really work through our full volume of vaccine in as quick a way as possible.
Thanks. Do you know how much they scaled back, like by how many hours and when that came into effect?
Sorry, Katrina, I don't have the answer to that question.
We'll follow up with you on that one, Katrina. We do have a bit more time, so we will go through one more time if everyone would like to ask one more question. We'll start with Kelly Botello. Kelly, if you'd like another question, you can go ahead. Okay, we'll go to Lisa Pileski next. So Lisa, if you'd like another question.
Just my only other question was not necessarily related to the vaccine rollout, so I don't know whether that's okay or not.
Go for it.
Okay,
Paul says go ahead.
Okay, thanks.
And if we say no because it's the wrong person, we'll get back to you. So try it out.
Okay, well, this is, I guess it would be really for Paul if you you know, are able to answer. We're definitely seeing some concerning new numbers from today's COVID-19 update. I mean, the positivity rate, the reproduction number, weekly case rate, those have all kind of gone up, you know, and cases are continuing as well as the variants. So just wondering about the possibility of further restrictions from the province. You know, there's that emergency break and whatnot. Do you anticipate that that's something Hamilton could see in the near future?
Well, the reality was when we came out of the stay-at-home orders, that was a very important tool that the province put in place to handle situations that you've seen around the province. So whether Hamilton has to go there, needs to go there, will depend on our actions and exactly how those cases and numbers look as we go forward. So is it a possibility? It's a possibility in every community. And I think what you've seen in some northern communities who, you know, for much of this pandemic, were probably situated in colors that were much more towards the green and less restrictive area. Now, all of a sudden, in looking at very high numbers and having to execute either on that emergency break or head into more restrictive areas. So it is something that's concerning. And as I've said many times, and Dr. Richardson, you know, backs that up by talking through the numbers, we are tackling two things simultaneously. We are very much in a state of emergency and looking at large numbers of outbreaks and large numbers of cases in this community, and the need for us to do all of those same things to control the spread of this virus, while at the same time fully operationalizing an approach which will allow us to vaccinate far more people than we have in the past. And that's the duality of our work right now, is looking at both of those. So yes, every day, I know Dr. Richardson and her team are looking at those numbers and the concern around those numbers, while also looking at how do we scale up? How do we do the things around vaccination? So it is concerning. We've seen a steady growth in that numbers per 100,000, and the reproductive number that was just released based on yesterday, the 7 days up to yesterday, still shows that we're above 1, and that also isn't a great indicator. So concern, yes, hasn't changed much in the last couple of weeks since we started to see that slow increase and obviously a reversal of the decrease. And I can tell you on a day-by-day basis, we continue to deal with the outbreak issues and the crisis issues of this pandemic as much as we are dealing with the ramping up of our vaccination program.
Great, thank you, Paul. We'll go next to Christine Rankin. Christine, if you'd like another question, you can go ahead.
Great, thanks so much. I guess I would just ask, are there any challenges getting the vaccine from the province other than supply issues?
Hi, Christine. Thanks. So at this point in time, no, we don't have any issues with respect to getting vaccine. It's really just the quantity and the supply that is preventing us from going forward. But with respect to receiving vaccine, no, that's not an issue.
Okay, we'll go next back to Katrina Clark. Katrina, you can go ahead.
Thank you. I think there's been a little bit of confusion around this March 10th date as being when, people get their shots 4 months later. Am I correct in that it's like anyone, regardless of when they got their first shot, if they're still waiting for their second one now, it's going to be coming 4 4 months from now. It's not like if you got it on March 9th, you're still getting it at the 2-week period or whatever. It's everyone who's still only gotten their first shot will get it now in 4 months.
Hi, Katrina, thanks. So yes, you have that correct. Anyone that hasn't received their second dose as of now won't receive one until 4 months after their first. There are some exceptions, however, for our residents in long-term care homes or retirement homes. They will continue to receive their second dose on the original schedule. And so that goes as well with our urban Indigenous adults as well. We'll continue to receive second dose on their original schedule.
Great, thank you, Michelle. Mr. Mayor, that's the end of our media questions for today, so I will pass things back to you.
Thank you very much, and thank you all for attending and sharing some information. I do want to point out that one of the challenges that we've seen is that when folks are registered on our system and they've got the first call in, that we're having some difficulty getting people to pick up the phone to get the second call. So you do need to be mindful of whatever process or number you left with healthcare officials in terms of second contact, that you keep an eye on that, because that is the path that they're going to reach you at to try and set up a secondary appointment. So please keep your eye on your phones and do respond. I think we've had a less than stellar response rate given the amount of calls that we've received initially. And the callbacks have not gone as successfully because people haven't necessarily picked up the phone. Beyond that, our media partners and Bill Custer's and Clear Cable and Cable 14 continue to do an outstanding job for us to make sure that we get these media advisories out there. And thank you for setting this one up in a hurry. We thought it was important to discuss the vaccination process as the provincial system starts to roll out on Monday. And we will be back here on Monday with any additional information relative to COVID-19 overall. For the most accurate information relative to what's happening here in Hamilton, go to hamilton.ca/coronavirus, and all of the information pertinent to COVID-19 vaccinations and otherwise will be there to help guide you in terms of the information that you need to make informed decisions. So thank you for participating today, and we will look forward to seeing you on Monday, March the 15th, with hopefully a smooth rollout of a provincial system. And we'll be back here at 3 p.m. to share any and more additional information. Be patient, be kind, take care of one another, and we'll see you on Monday.